In this video I want to take a look at a couple of stories I came across there this week. Interesting stories to do with COVID-19 and the pandemic and so on. Firstly, 3 million deaths, 3 million dead as a consequence of coronavirus, according to and as reported by Johns Hopkins University in the United States. Johns Hopkins University in the United States have kept a very close eye on the coronavirus since the pandemic started, and they have a big map apparently on their website which shows the number of cases each day, the number of recovered cases each day or every week and so on, and the number of deaths. And they have done that for since the beginning of the pandemic and for all over the world. In January of 2021, 2 million deaths had occurred as a consequence of coronavirus. In 17th of April 2021, the figure is now 3 million deaths as a consequence of coronavirus. And it's actually considered or thought that the death figures would actually be higher or are higher, because many governments are actually concealing the true figures simply because it's too embarrassing, and obviously it does reflect on the government's maintenance of its society and its healthcare system and so on. So 3 million deaths, 2 million in January, it's an appalling figure, and that's from Johns Hopkins University. That's one story I came across this week that I found interesting and kind of seminal, because obviously the 3 million figure is important. The second one was a report there from the coroner in County Kildare, Professor Dennis Cusack, and he has reported that a preliminary investigation of suspected deaths by suicide in the county has not increased significantly. In other words, there may well be, and there is indeed, mental health effects from coronavirus and so on, but the data from Professor Dennis Cusack in Kildare is that the suicide rate has not increased significantly. And this report is actually consistent with a report from Professor Appleby, who's a professor of psychiatry in Manchester in the United Kingdom. He's a government advisor and researcher on suicide, and he's published a report on the British Medical Journal website. And the report's main finding is that suicide rates haven't risen, but we should be cautious. And indeed we should be cautious. But we should also be cautious about banding around fears and concerns and making up stuff that don't exist. What we should be doing, in my view, is relying on data, evidence, science, facts, as opposed to assertions and statements and so on. So there are 3 facts from Johns Hopkins University, Professor Appleby in the United Kingdom in Manchester, and Professor Dennis Cusack here, all relying on evidence, on data, and basically giving the lie to certain fears that have been put around by the so-called COVID deniers, the anti-mask, anti-COVID, anti-lockdown people. Those people have made a number of assertions, particularly to do with the question of concern, purported concern for the mental health of people as a consequence of COVID-19. There's no doubt about it, there is going to be mental health consequences and so on. But making up facts doesn't bolster anybody's case, and some of the claims made by the deniers, the COVID deniers from the outset, for example, that it didn't exist, COVID pandemic did not exist, or it was no worse than the flu, is a serious insult to the memory of the 3 million people who have died, and it's in pouring insult upon injury on people whose families who have suffered deaths and who have suffered from long COVID and so on. Those people they need a better degree of respect than people making assertions and making claims that COVID-19 is no worse than the flu, when in fact they have suffered long COVID or they've suffered a death in the family as a consequence. We're not going to get out of this situation, bad and all as it is, by making up assertions, by making up so-called facts, by pulling stuff out of thin air, by hunches, by going along with stuff that you might see on Facebook or Telegram or WhatsApp groups and so on. The only way we'll get out of it is by reliance on the public health guidance, the science, the data, the evidence, and by soundly based public health guidance, and by the rollout of the vaccination programme. Looking forward to that. But as I say, there are a couple of stories I came across this week, and the 3 million deaths figure clearly is a sort of a seminal moment in the whole coronavirus situation. And obviously 3 million deaths is a serious number, and the fact of the matter is that some governments have probably concealed the figures out of embarrassment. Anyway, hope you find the video useful. If you do, I'd appreciate if you give it a thumbs up down below.